Good evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight,
starting in 2022,
there are a lot of ways to end that sentence. We'll tell you about some of the new laws taking effect in the new year.
I am not gathering right now indoors with anybody who is not vaccinated and boosted.
One-on-one with Chicago's top doc on vaccine mandates, COVID testing, and more.
Science has demonstrated less than a third of people are isolating when they need to.
The CDC changes its isolation guideline for asymptomatic COVID patients. How health leaders and public officials are responding in Spotlight Politics.
What a new study on CTA ridership during the pandemic tells us about the future of transit in Chicago.
Chicago's Jeff Tweedy talks about post-COVID touring tips for songwriting and more, revisiting our conversation with the Wilco frontman.
I like being at the game. I'm seeing the guys run and hit and drop and, kickers miss the balls. That to me is fun.
Remembering the late John Madden with a look at his 1986 appearance here on Chicago Tonight.
And revisiting a local exhibition by legendary street photographer Sabina Weiss, who died yesterday at 97. But first, some of today's top stories. Midnight fireworks and bridge closures are part of the city's plans to celebrate the new year, but safely. The Office of Emergency Management says the 1.5-mile-long fireworks display can be viewed along the Chicago River from Wolf Point to Navy Pier, closing pedestrian traffic along the Riverwalk and using 5 bridges and 2 river launch points to launch those fireworks, of course. And in advance of New Year's Eve, the city is reminding residents of COVID safety protocols, especially masking up at indoor public spaces. Mayor Lori Lightfoot also had this message for parents and young people about how they spend their time downtown.
And do not simply drop them off downtown and hope for the best. That is simply not responsible. And I say this as a parent. We all have a responsibility as parents or guardians or somebody who is a caretaker for a young person to be responsible for the children that are trusted in our care. And a word to our young people and older adults. And I will say the same thing that I say to my child. It's okay to have fun, but there are always limits.
And today, the Chicago Department of Public Health reports a COVID test positivity rate of 16.2%. That's nearly double the rate 7 days ago. CDPH says on average, there were more than 3,800 cases per day in the last week, and 90 people were hospitalized. And we'll have more with the City Public Health Commissioner, Dr. Allison Arwady, in just a few minutes. Driver services facilities statewide are closing down for the first 2 weeks of the new year because of rising COVID cases. The Secretary of State's office says some transactions can still be completed via the website, like renewing a license plate sticker or even a driver's license for those who qualify. The office had already extended all driver's license and ID card expiration dates to March 31st. Facilities are scheduled to reopen on January 18th. Up next, a look ahead to some of next year's new state laws. Stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
It is impossible to know what the new year will bring, but 2022 has some changes in store for certain. Amanda Vinicky joins us now with a rundown of some of the new laws taking effect in the new year. Amanda.
Paris, I'll be honest, reporting on new laws that took effect at the beginning of this year was kind of tough, and that's because of COVID. The legislature in 2020 was a bit off course, so they didn't pass a lot that took effect in 2021. That is not the case for this year. There are a lot of laws taking effect in 2022, so an early plug. Be sure to tune into Chicago Tonight tomorrow evening, where I'll be reporting on new laws that might change everything from what happens when you visit a pharmacy to trying to apply for a license for a gun. Now, for this next few minutes, I'm going to be focusing on laws impacting education, including a law that requires Illinois schools, K through 12, that is, teach 1 unit of history regarding Asian Americans and Pacific Islanders.
It does mean that Asian American history, which is often invisible, there's there has been Asian Americans in this country since the mid 1800s, but there hasn't been a lot taught in the schools, and this will allow all the challenges as well as all the successes to be part of American history that's taught to schools.
Now, technically, schools have until the 2022 to 23 school year for actual implementation, but the work does begin now on developing a unit, and the law does not require specific lessons be taught. Grace Chan McKibben says that there are a lot of options.
Which is the first act immigration law and the only immigration law that excludes a whole group of people on the basis of nationality, and then the Japanese incarceration during World War II, where citizens, regardless of where people, because of nationality or national origin, regardless of citizenship, were incarcerated.
A different law says that when teaching history, Illinois schools have to include contributions to society by Americans of different faiths, including but not limited to those of Muslim, Jewish, Christian, and Buddhist Americans. Now, meanwhile, schools may have to update their dress codes. Another law taking effect bans schools from discriminating against natural and ethnic hairstyles like locks, twists, and afros. This is named the Jeff Hawkins Act after a 4-year-old whose school did not allow him to wear braids.
The real culprit here are the instances where Black youth have been expelled from school, suspended, forced off school or sports teams and things like that. So that's the way we wrote the legislation. I'm hoping that schools will take it as a gesture to be more open-minded around all hairstyles, right? It's a form of expression. And study after study has told us that discriminating against hairstyles for young people has a negative effect on their mental health. And so given everything that our young people are going through this pandemic, we need to be doing everything we can to help them heal and to learn.
Students experiencing mental or behavioral health issues will now be permitted 5 excused absences from school. That's because in 2022, Illinois will include mental health as a valid reason for missing class. After 2 mental health days, then school can refer that student to appropriate school personnel, somebody perhaps like a counselor. Now, meanwhile, graduating Illinois high school seniors no longer need to sweat taking the SATs or the ACTs in order to get into one of the state's public universities.
Meaning that a student from Chicago or Evanston or Des Plaines can apply to college at the U of I, Eastern or Chicago State, and the admissions process will consider things like their GPA, their interviews, their extracurricular activities, but there's no requirement to submit standardized test scores.
Students can submit their scores, but they don't have to. Representative Cam Buckner says that this is a way to give Illinois residents a leg up in the admissions process. When students leave the state to go to a school, say somewhere like Arizona, he says, they often don't come back.
If you look at enrollment at places like the public universities in Arizona, you'll see a bumper crop of Illinois residents. This addresses that and gives Illinois residents a leg up. Out of all the 50 states in the union, only New Jersey loses more of their college-age individuals out of state who never return compared to us, right? And so we want more Illinois students to stay in college, to stay in Illinois for college, to contribute to our state, to contribute to our economy and to raise families and start businesses here.
Buckner says this law can help to close achievement gaps. He says standardized tests don't necessarily capture a student's potential.
We know that these test scores can often act as a barrier to post-secondary education. And furthermore, far too often when we see those folks who do well on test scores compared to those on standardized tests compared to those who don't, we know that they come from a certain socioeconomic background in many cases. And far too often the wage gap with families turns into the educational achievement gap, which turns into the quality of life gap, and then into the life expectancy gap.
A couple of weeks into 2022, on January 17th, Illinois will have its first commemorative holiday honoring Muhammad Ali. January 17th being Ali's birthday. Now, again, this is just a small sampling of the laws, and we will talk about more tomorrow, including laws impacting consumers. With that, Paris, back to you.
A lot changing starting on Saturday. Amanda, we'll look forward to part 2 tomorrow. Thanks very much. And now to Brandis and the latest on how Chicago is addressing the spike in COVID cases. Brandis.
Paris, thank you. City officials say a combination of travel and social gatherings over the Christmas weekend are causing this post-holiday surge in COVID cases. They're urging the public to get vaccinated and to get tested. But many people are reporting challenges in finding tests. And with us now to discuss the surge and all things COVID is Dr. Allison Arwady, the commissioner of the Chicago Department of Public Health. Thank you for fitting us in again, Dr. Arwady. So as we discussed earlier in the show, the test positivity rate just over 16%. Now that's a significant leap from 7 days ago at 8.2%. What would you say are the factors that are causing this surge?
So the biggest one clearly is Omicron. This is a much more infectious variant, and we are seeing it spread rapidly. So we're seeing both an increase in terms of tests, and as you noted, we are seeing more challenges with testing capacity, not just in Chicago, but across the country. And in that setting, with more spread and somewhat lower testing, positivity is very much up. Twice what it was a week ago, twice what it was a week before that, matching the pattern that we're seeing all over the country.
And the CDC now, it's also getting some criticism for reducing the isolation time from 10 days down to 5 days for those who have tested positive. Professionally, what is your reaction to this change, and what do you expect the city will do with regard to following suit?
Yeah, so the first thing that we did was reach out to CDC and say, I want to see that data. I want to see what it is based on. And really, where you look at the data, particularly with the Omicron variant, clearly we are dealing with a faster moving variant than we've seen before. Shorter time period from when someone is exposed to when they are potentially become infected and can start spreading, shorter amount of time frame. And so I do agree that a shortening of quarantine and isolation does make sense. Certainly, we're still looking at some of the more sensitive settings, though, right? Recognizing that I think the 5-day recommendation for the general population does make sense, and we are going along with that. But we're still looking at some of the more specific situations because we want to make sure that we don't inadvertently, create a situation where folks are not as protected as they need to be. But I think overall it is good news, and we'll be watching the data here closely.
So beginning January 3rd, the city will be enforcing a vaccine mandate for all indoor public spaces. Well, you're already doing that, of course, but particularly showing proof of vaccination for certain locations, restaurants, gyms, the like. This week, we heard, though, from the Chicago Restaurants Coalition arguing that they have not had enough time to prepare for this. Here's Roger Romanelli, the coalition's coordinator.
In terms of dealing with the COVID surge, we really need all hands on deck. And again, like I say, since the pandemic began, the restaurants have been doing wonderful work to keep everybody safe. I would just say to you that if the mayor's intent is to get more people vaccinated and for us to defeat the virus, then if it's good for restaurants to check vaccination papers, anyone that walks into City Hall or any government building in Chicago, they should also be required to show their vax papers and their IDs.
Now, at the end there, Romanelli is saying that he thinks we should be required to show vaccination papers going into any public building. But on the other side of his argument, though, is that this new mandate, it goes into effect after the holidays when a lot of people have been gathering. Could the city have done anything differently with this rollout?
So honestly, when we were looking at doing this, we did this in conjunction with talking to industry partners. We know that they are going to be the ones actually looking at vaccination cards at the door. We did the work to carve out their own employees where that is necessary, because the goal, and we can't wait on implementing this. You just look at our numbers in terms of what we're seeing and know that right now here in Chicago, where we look at who is driving the hospitalization surge with COVID, it is the unvaccinated. We've seen almost no increase in COVID hospitalizations among people who are fully vaccinated, people who've gotten a booster, even better protected. But that big surge we're seeing is in the unvaccinated. Now really is the time to do that. And the reason why we've focused on settings like gyms, restaurants, and then entertainment venues where food or drink is being served is because those are known to be riskier settings from a COVID perspective. People are taking off masks. People are exhaling more. It's where we've seen things being linked. So I I of course am in support of vaccination in all kinds of settings, but we've tried to be very focused here on optional activities that really at this point with where we are right now, you've got to be vaccinated to be able to enjoy those.
So, Doctor, we know that we've been hearing about a lot of long lines at COVID-19 testing sites. Those at-home test kits, they are sold out and difficult to find. Now, this has led to, some bars and churches and other sort of non-medical sites offering free testing. But is the city considering a return to city-operated testing sites?
So just to be clear, we continue to operate city testing sites. We've got sites that are open and continue, in partnership with various folks around the city to make sure it's available. We also, CDPH has actually distributed about 150,000 of those rapid testing kits in parts of the city that are being hardest hit. We've worked especially in congregate and higher risk settings to make sure the testing is available. I wish we had more rapid tests to be able to distribute, but the fact of the matter is the whole country doesn't have them available. We've had an order for 10,000 on hold for more than a month with no sign of anything coming through. And so we are exploring additional ways to potentially expand testing, but the more of the problem is not, can I find somebody to swab your nose? More of the problem is that the laboratory network across the whole country is so stretched that it's taking many days for folks to be able to get those PCR test results back. So what we're really asking people to do is, first, if you take a home test and it's positive, stop there. You have COVID. Just assume that it is positive. We don't need you to go out and try to get another test in a medical setting. Stay home, isolate for those 5 days, wear a mask for 5 days after that. And if you're not able to get a test, the most important thing is to stay home, honestly. Be in touch with your doctor's office. They have access, certainly if you're at higher risk, but we do not want folks trying to go to the emergency department just to get a test if you're otherwise feeling okay. And where people are vaccinated, and especially vaccinated and boosted, we're seeing a lot of very mild infections. Good news, but we would prefer not to have too much clogging up, of the testing system, because I know it can be frustrating for people when you're waiting days for results to come back.
Of course, and I'm sure some people would rather get the real test because they don't want to isolate if they may not have it, because people have pandemic fatigue and they're like, I'd probably rather just stay home or probably rather live my life if I'm not certain that I have it, or if I might not. But we're also hearing a lot of reports of illegitimate or seemingly sort of illegitimate and questionable pop-up testing sites. What is your advice to people with regards to where they can be accurately tested?
Yeah, so certainly the tests themselves actually are performing well. All different ones are. The at-home ones perform well. The ones in facilities perform well. Certainly we've heard some of those concerns as well. The city does not actually regulate any laboratory or testing type facilities, but where we've heard concerns about those, we have passed those on to regulatory agencies. I think those at-home tests, honestly, are very good. The antigen ones, I was on Amazon just last night taking a look myself. It's true I couldn't get one for tomorrow, but I could order some to be here in a few days. And I've been staying ahead of that to have some of those available. So for people with resources, I would strongly encourage you to order some of those. You can get them reimbursed on health insurance. Your HSA can pay for them while the feds are ramping up more and more production for them to be truly available. And we're working at the health department to fill in all of the gaps in as many ways as we can. But for right now, if you think you have a cold, if you think you have flu, especially if you've got a positive test of any kind, treat it as positive. It is probably COVID, and we need you to isolate.
Absolutely. Dr. Allison Arwady, thanks again for joining us. Best of luck.
Thank you.
And now, Paris, we go back to you.
Thanks, Brandis. The drop in CTA ridership during the pandemic was not citywide, according to a new study. The Urban Institute found that while downtown ridership decreased, neighborhoods with more Black and Latino residents saw more sustained ridership. And joining us to talk about what it could mean for Chicago's transit future are Aaron Alleman, Executive Director of the Chicago Metropolitan Agency for Planning, and Olatunji Obai-Reed, President and CEO of Equiticity. Welcome back, both of you, to Chicago tonight. And before I ask any questions, let's take a look at some of the findings from that study in terms of stations that lost the most ridership versus the least. So, largest decline, Merchandise Mart, Addison, Red Line, Monroe, Blue Line. And then the smallest decline, Pulaski Blue Line, the Conservatory Green Line on the west side, Central Green Line also on the west side. Obai-Reed, what do you make of these findings?
Sure. Well, the findings in many ways tell us what we already knew. The people who are the most dependent on transit in our region are Black and brown, low to moderate income, and live on the south and west side. And what the pandemic showed us is that we are often the ones who are in the role of essential workers. We don't have the luxury of working from home. We are on the front lines every day and require transit to live our daily lives.
Aaron Aleman, is that how you see it? This is essentially showing the so-called essential workers who rely on transit, they're still using transit versus folks that perhaps could afford to stay home?
That's exactly what we're seeing here, Paris. And I think what is of keen interest to us is trying to understand what transit looks like and ridership looks like post-pandemic, because it is a crucial part of our economy and the way people get to the jobs that exist here in our region. But understanding, what percentage of white-collar workers are going to shift and really understanding how that reliability and service can continue to serve and be enhanced for people who are transit dependent.
And we should mention that this study shows similar results in other big city transit systems as we're seeing here in Chicago. So, Obai Reed, what should this mean in terms of transportation policy starting now and going forward?
It underscores the vital importance of operationalizing racial equity in our transit system here in the region. Every agency that's executing around transit should have an operational commitment to racial equity. And the fundamental way that this plays out is in the distribution of resources. What this analysis shows us is that those who need transit the most should receive the most resources in terms of transit, ensuring that it is meeting the needs of Black, brown, low to moderate income people on the south and west side.
And Aaron Aleman, how does that translate to specific projects? What are the specific needs right now?
Well, I think we need to think about some of the connections that need to be made in our transit system. For example, you can take a job in a city if you're going to work in transportation, logistics, and warehousing, but you can't get that last mile from that transit station to that place of employment. And so one of the things that we're hopeful that the infrastructure bill at the federal level that was just passed will help us find ways to, support bus service perhaps from the end of the lines to those jobs that exist, that will help us invest in walkability and bike infrastructure that will help people get to the places that they need to go at the end of the lines, but better connect the system throughout from bus to rail.
And Obai Reed, one of the big projects that's been talked about and planned for years is the extension of the Red Line to 130th. So if you had the mayor's ear, what would you tell her in terms of how some of this federal infrastructure money should be spent on CTA projects?
Well, we need the Red Line extension. The reason that the Red Line stops at 95th is a result of structural racism in Chicago. We needed to extend to the further south outskirts of Chicago. And what I would tell her is that quality transit helps improve life outcomes for people. It helps improve educational outcomes, health-related outcomes. All number of outcomes are lifted up when quality transit is present in neighborhoods. So I would encourage her, should she believe in her commitment to racial equity, it should be reflected in that federal money coming down to the region, to the city, have a racial equity lens attached to it, and Black and brown-led community-based organizations are part of the conversation that decides how those resources are going to be distributed in our region.
Obviously, that Red Line extension, a very important project. Aaron Aleman, on the flip side of this, if you look at the stations with the most declining ridership during the pandemic, not surprisingly, the loop stations with fewer people going to downtown offices for work. And now companies are saying this is going to continue. This might be the new normal, more people working from home. So what does that mean for the public transit system writ large?
Well, a couple things. We were looking at prior to the pandemic, what the percentage of the workforce was that was going to be able to work from home. And so when we ran these numbers before the pandemic, we were thinking maybe 10% of people would be working from home. When we're running those numbers today and looking at where people are working right now, we think in some places across our region, it's going to be 35% of jobs will be working from home on any given day. But, I think the real impact will be on our road system here that we see. If 25% of people don't go back to transit, we expect people will be stuck in traffic for another 192,000 hours, which equates to about $1.2 billion in lost productivity. And that's people and goods that can't get to the places that they need to go if we don't have a well-functioning transit system. And
not to mention the loss in revenue for that transit system. So then what is the solution to entice more people to transit if they're not going to their jobs on it anymore?
Well, I think we need to think about reliability of the system and, where the access is getting us to, so that more frequent service during the day to places that people need to get to. We're seeing daytime movements across our region increase. So while the morning peak hasn't quite gotten back to pre-pandemic levels, people are, taking their trips during the day. They're going downtown in their own communities to get lunch as opposed to in the central business district. So we really need to think through, what are the barriers to changing our transit system? And some of that is old formulas that drive the way that we spend our resources.
All right, a lot to think about. The transit, so important to the economy and the lifeblood of the city. And our thanks to Aaron Alleman and Olatunji Obai-Reed. Thank you guys so much.
Thanks.
And up next, remembering a renowned street photographer, so stay with us.
I come from a people that not only found a way to survive through the most horrific circumstances, but they thrived.
I could not save one of the boys of color in my own life. If my family could be exposed to this horror, then really it could happen to anyone. We are truly all in this together.
She may not be a household name, but you have likely seen her fantastic photographs. Sabina Weiss photographed Bridget Bardeau and fashion models and Roma people and kids on the street in post-war Europe. She died at her home in Paris yesterday at age 97. We spoke with her in 2017 during just her second solo exhibition in the United States. Her first was at the Art Institute in 1954. Here's Phil Ponce with another look at a celebrated photographer who captured the human condition with her camera.
She photographed Paris, New York, and people and places all over the world. Born in 1924, Sabina Weiss remains focused on photography. She met us at the Stephen Dater Gallery to discuss the photos she took so many years ago, including her very first pictures.
I was very young. I think I was 8 years old, and I buy my first camera, very simple, kind of thing that you never see anymore. And I know it because I have a book where I glue all the pictures from my first film.
The Swiss-born photographer moved to Paris in 1946. She remembers the City of Lights after the war.
It was a lot of children walking on the street, they have no television, no games and things like that. A lot of people on the street. And even along the river also, it was very free,
Weiss contributed photos to the famous exhibition The Family of Man at the request of the photographer Edward Steichen. In a field dominated by men, she didn't find being a woman an issue.
But it didn't change anything, Maybe it's easier to be accepted by the people you take in picture.
The gallery show focuses on Sabina Weiss's street photography. She funded these efforts with high-end assignments for Vogue, the New York Times Magazine, and Life magazine. She photographed the actress Jeanne Moreau. She worked with Bridget Bardeau. And she caught Ella Fitzgerald up close and personal. In fact, Sabina Weiss was too busy with work to attend her solo exhibition at the Art Institute in 1954. Her vintage prints from the 1950s now sell for $10,000 or more. She's no longer in the business of taking pictures. An assistant helps her organize and present her archive.
You know, one day at the end of the 70s, someone said, Sabina will organize you a show. You cannot just keep these photos in boxes, and you should show them in an exhibition. She said, okay.
As a photographer, Sabina Weiss knew what she was after.
You ask me if I take a lot of pictures or just one. Most of the time it's just one. But after, when I get the picture, maybe I keep taking some other position or composition.
It's incredible how she sees, you know, exactly the good pictures.
But when I see something will touch me, I have the feeling to take the picture immediately, you know.
It's part of her personality, you know, that work. She's like that. She's always taking care of people, and she wants to help. So maybe with the camera, it's a way of contacting them. We need like 60 years more to work. It's never ending, you know.
The photographer is happy to look back on her life's work.
I'm very pleased, you know, because I love my pictures, you know. What can I do? They are very good.
And that was Phil Ponce with a look back at a 2017 exhibition by photographer Sabina Weiss. She died yesterday at age 97. Now, Paris, back to you.
All right, Brandis, thanks very much. And still to come on Chicago Tonight, Chicago's vaccine mandate for restaurants goes into effect Monday, just as city and state COVID cases hit record highs. Our Spotlight Politics team discusses that and more. This was a fun one. We revisit our summer conversation with Wilco's Jeff Tweedy, who talked with us from his tour bus on the way back to Chicago.
All you got to do is kick the ball.
Another fun one, remembering the colorful John Madden and his 1986 appearance on Chicago Tonight. But first, some more of today's top stories. Chicago Public School students have a couple of extra days to turn in at-home COVID tests. The deadline to mail in those at-home tests had been yesterday, but has been extended to Thursday after packages reportedly piled up at FedEx drop boxes seen in these pictures here. Students can also return the kits to one of a handful of public library locations. CPS has strongly urged all students to test before coming back from winter break next Monday. And the state records its second highest new COVID case total since the start of the pandemic, with more than 21,000 new cases. Illinois also sets a new record for 7-day average of new cases and records 50 deaths from coronavirus in the last 24 hours. The statewide test positivity rate is up to 13.2%. A big honor for Chicago Sky Star and Naperville native Candace Parker. The WNBA champ was voted AP Female Athlete of the Year after leading her hometown Sky to its first league championship. Parker joined the team mid-season after a long and successful career in Los Angeles. And now, Brandis, we toss it back to you.
Paris, thank you. COVID, as we know, is surging across the country and, of course, right here in Illinois. Mayor Lori Lightfoot's vaccine mandate for some indoor spaces goes into effect Monday. The Centers for Disease Control and Prevention faces criticism, though, for changing its isolation guidelines. And a new report reveals some tension between Mayor Lightfoot and Governor Pritzker. Here with all that and more are Amanda Venicky and Paris Schutz. Welcome back, team. So today, the Centers for Disease Control and Prevention clarified why it changed its isolation guidelines. Here's a clip from the director of the CDC, Dr. Rochelle Walensky.
We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to. And so we really want to make sure that we had guidance in this moment where we were going to have a lot of disease that could be adhered to, that people were willing to adhere to, and that spoke specifically to when people were maximally infectious.
So, Paris, how have both the public and health officials responded to the CDC's change in guidelines?
I think, as you heard with Dr. Arwady earlier today, confusion among public officials and the public, especially since cases are reaching record highs right now. And you heard there from the CDC director that a lot of this is because people haven't been adhering to these standards in large numbers. And it's clear that CDC and the federal government was responding to a lot of pressure, perhaps from employers, worried about workers being gone for 10 days because so many people are getting COVID now and going out. And it's confused people who aren't looking at the fine print. Remember, this applies to those that are asymptomatic. So if you're asymptomatic, the CDC is saying, okay, quarantine for 5 days. But then, for the next 5 days, be very diligent about wearing a mask around other people. If you are symptomatic, probably good to quarantine for that original 10-day period.
So here in Illinois, city and state data show that record-setting daily case counts and averages are happening. Amanda, Christmas just passed. New Year's is coming this weekend, of course. What are public officials saying about an expected rise in COVID cases, even beyond, of course, the rise we're already seeing right now?
Well, for starters, if you had big, fun plans to party hard on New Year's Eve, they're saying don't do so. Really, it's back to stay at home, hang with your pod, bring in the new year in a safe fashion is what they're encouraging. And then, of course, they're saying they've got to prep for this. What we don't know is if at all it is going to get to a point where they're going to need to increase any sort of, open any additional hospital beds or anything along those lines right now. That is not something that we're hearing a lot of talk about, but certainly there are concerns about primarily when we talk about shortages in hospitals, there's sometimes an element of space, but really most of the time officials say what they mean by that is there aren't, when they say there isn't enough bed space, is that they mean there aren't enough doctors, nurses, other medical professionals to care for those patients. So it is certainly a concern and something that they are keeping an eye on, particularly, something to keep in mind with when we look at these positivity rates, by the way, all these at-home tests, that's not included. Those are just the tests that actually have, gone to one of these specific sites and have been logged.
Right, and stressing the system. We also heard Dr. Arwady earlier say that it's also about the lab network not being able to test as many people as we see getting in line, seeking a test. Now, earlier this week, Governor Pritzker spoke about the pressure the surge could have on the healthcare system. Here's some of what he said.
If you are unvaccinated and you get very sick, you'll be filling a bed that would have been available for your ailing spouse or your parent or your child or someone else's child, someone with cancer or a heart attack or seriously injured in a car accident.
So, Paris, how concerned then are public officials and healthcare leaders about the stress that this COVID surge is going to have on our public healthcare system, the hospital system?
Very concerned just for that reason that the governor laid out. If folks have other issues that they need to go to the hospital for, there are lines out the door. It's tough to get a bed. And throughout the state, we've seen most regions, the ICU capacity is 10% or less. A little more positive is the fact that ventilators are not in horrible demand right now. There still is enough ventilators to meet the demand out there. There was a worry about that earlier in the pandemic. But then the bigger issue, it isn't equipment, it's people, as Amanda said. It's burnout. You talk to so many hospital executives that say, 2 years of dealing with this, nurses, doctors, staff members, they're so burnt out emotionally, physically, and then you add in so many people are coming down with COVID among staff, so they have to go home, so there's no guarantee that there's going to be a fully staffed hospital for folks to go to if they do get sick. So these are the big concerns right now.
Yeah, a lot of concerns, obviously. Now, speaking of testing, of course, CPS strongly recommending that students and staff that they get tested, and that deadline was supposed to have been today, or excuse me, Thursday, that they get tested before returning back to school next week from break. Amanda, you've been reporting on this. What's the latest?
Well, yeah, so the latest is that, that Tuesday deadline came and went. We saw those overflowing FedEx boxes. There's been one added location, Garfield Ridge Library, but then also the deadline extended. So now until 5 o'clock on Thursday is when these tests will be accepted. Unclear, what we don't have a lot of information on from CPS is due to, again, that lab strain that we've been talking about, if those will be processed on time, and then when begins in schools as classes resume on the 3rd, how much testing there will be there, because that has likewise been slow to ramp up. What CPS has said is that they are prepared to be agile in determining when either classes or schools writ large need to be closed because of a rise in cases. We thus far are not privy to what internally they're deciding is going to make the district take that leap. No updates there.
Okay. Now, on Monday, both Chicago and Cook County's vaccine mandate for certain indoor settings, bars, restaurant, gyms, those go into place. Paris, what impact do both the mayor and Cook County Board President Tony Preckwinkle, what impact do they hope this will have on the spread of COVID?
Well, they've said, and we have to make the point, it doesn't mean that if you go to one of these places, you're not going to get COVID. I mean, we've seen that it's spreading in New York. That had that kind of indoor mandate for months, but it's more the stick approach to getting people vaccinated, hoping that they increase those vaccination rates by telling folks that if you want to enjoy all the great indoor activities, the concerts and the restaurants and the bars and the gyms and the other indoor venues, you want to just have a normal life in Chicago, you're going to have to get vaccinated. So it is trying to urge more people to get vaccinated to be able to participate in normal life.
Now, of course, we heard just yesterday from some Chicago restaurant owners who are saying that they need more time before implementing this. Paris, do you think the mayor will consider this?
I have a hard time believing that the mayor would go back on that January 3rd date. I mean, they did get a little grief from some folks initially because that time period from the announcement to January 3rd was about 2 weeks. They're saying, why are you waiting so long? And we see the cases spiking right now. So if this kind of mandate's going to be put in place, and this is the time to do it, I can't see the mayor changing that time frame.
Now, also this week, Cook County Chief Judge Tim Evans announcing that his office's employees, now this includes those who work at the Cook County Juvenile Detention Center, that they will have to show proof of vaccination, which is a change. Amanda, why did he make this shift?
Well, his office in reporting has cited that it made the shift because of the Omicron variant, because of the surge in cases. That is why. I'll add, though, that he has, of course, been under pressure. The Juvenile Detention Center, these places are congregate settings. Judges are elected officials, leaders ostensibly, who therefore should be sort of, getting vaccinated and leading that charge if there is a call for others to do so. So I think it is also, particularly given that when light was shown on the fact that that court system was not under a vaccine order from Evans, that he was under political pressure to do so.
Okay, now in other news, shifting a little bit, the Chicago Tribune published a report today on text message exchanges between the mayor and other public officials, including Governor Pritzker, especially. Paris, what did you find most revealing about this report?
Well, I think the thing that stands out are those text exchanges with Governor Pritzker. A lot of sharp elbows thrown. The mayor's accusing the governor of being behind bad press coverage or having the governor's staff leak bad press coverage. The governor saying, we have nothing to do with that. And, oh, by the way, it's better to call me and not put this kind of stuff in a text. But you see sort of these repeated exchanges with the governor, and it kind of fits in with what we've seen from Mayor Lightfoot is she's very sharp-elbowed. She does know how to throw a punch, but it's not just with adversaries. A lot of times it's with folks that are her allies, her political allies, political friends, people that she needs to get things done for the city of Chicago. And Governor Pritzker is a natural ally, the same party, same ideology, both of them very pro-Chicago. And you see these kind of sharp elbows being thrown, and we've talked to council members over the last couple of years kind of wondering why that's the mayor's MO with people that could be very helpful, that she needs on her side. So credit to Greg Pratt at the Tribune for doing a FOIA of the mayor's cell phone text messages and kind of seeing this treasure trove of conversations.
I was actually, in terms of allies, in a way, you have constantly had Chicago mayors and governors of Illinois going head-to-head because while there should be a natural allyship, there's also a very natural tension. Who's really calling the shots? The state, of course, is statewide, but Chicago has a whole lot of muscle. So I think there's both a natural tension here. What was really surprising to me was that these text exchanges existed. As you saw in one of the texts from the governor, hey, maybe let's take this up by phone instead of by text. You don't often have political officials, those who are elected to office, least of all attorneys, putting that sort of stuff in writing because it is FOIA-able and they should know that. So it really is interesting to see this sort of unvarnished conversations. I think it also shows really sort of how weak Lightfoot is right now. You had her predecessor, Emanuel. It's not like he was a friendly guy. We've seen some of his texts, and I'm sure if we got all of them, there were some pretty hard jabs in them as well. But there is really sort of this reaction, I think, because Lightfoot did not come in with the same sort of relationships, and she has been weakened by her entire really time in office. So I think that is really part of it. And then finally, I think what was surprising to me as well was actually, you got to read to the end of that article by Greg Fred at the Trib there. And this is where she talks about a pension law that really does, in her words, ding, well, not in her words, she did not use the word ding, she used something more than that. Chicago taxpayers.
Yeah, yep. Amanda, we're actually fresh out of time. And FOIA-able, but also to your point, some conversations are just better had on the phone, person to person versus by text message. That's Spotlight Politics. Amanda Vinicky, Paris Schutz, of course. Thanks for joining us. And be sure to join us on Friday for a special year in review where we'll cover what happened on the political scene and so much more during 2021. Up next, we revisit an interview with Chicago rock royalty. Stay with us.
One of the most memorable conversations I had in 2021 was a summer talk with rock star and Chicago's own Jeff Tweedy of Wilco. Tweedy is a multiple Grammy Award winner and New York Times best-selling author. He joined us in August from his tour bus in Boston, soon to be on the way back to Chicago for a show at Millennium Park. I began by asking him how the time off impacted the band's dynamic on stage.
Well, I think John, our bass player, been in the band for as long as I have. He said it, I think, best when we first started playing. We've done this a lot more than we haven't done this. Just a year and a half off isn't really that much in the grand scheme of things when you consider we've been a band for 30 years. So, that's the way it feels. It came back. The connection and the band chemistry seems to be back fully intact, and in a lot of ways it feels better than ever because I think there's a deep appreciation of getting to do it again when we went through a period that's not that long, I guess, by general standards, but there was something added to that moment of not playing. We weren't sure when we would play again. So I think that being taken away, this knowledge that it was going to happen probably made us appreciate it more.
And you personally did do a lot of playing in quarantine. You had the Tweedy Show on Instagram, filmed by your wife and then involving your two kids. Let's take a quick look at that.
Gonna take a meteor shower.
So you filmed, I think, 200 episodes of this. Did you imagine when you started this that it would go on and become what it became?
No, we didn't have any idea that it was going to be something that we would continue to do frequently. It just, the initial response was kind of heartwarming. From the first time. We did it on my wife's account to kind of keep it a little bit lower profile than if we'd done it on the Wilco account or my own account. And people kind of found us, and it just seemed like a good way to spend the evening, and for us, and other people seemed to enjoy kind of hanging out with us, is what it really felt like. And it felt like that really almost immediately. So we just kept doing it. And the next thing, you know, that's how things go. Next thing you know, we've done 100 shows and we have a theme song, and you know, we just kept adding to it because we, you know, we were having fun, and it was a coping strategy, and it was really feeling like a supportive thing to do for the community, and there was a community that was responding to it.
You're continuing that, it seems, with a new Substack newsletter that you're basically updating on a daily basis. It's called Starship Casual. So tell us about some of the things you're posting on there.
Well, one of the other things I've learned in the last 5 or 6 years is that I enjoy writing prose, and I like getting to share that there's another outlet to do that other than writing books, and that's what the Substack has become. And I also create so many more songs than I'm able to finish or get to record or to share or release. And it's just another outlet for me to kind of feel some connection to these songs by sharing them, you know, getting some reaction and allowing there to be an audience for some of the stuff that, well, you know, a lot of things will probably end up on record someday, but they're things that I've had around for a long time, and I like them, and I want to share them with people, and this is kind of an opportunity to do that.
And one of the things you've also shared is your tips for songwriting. You mentioned you like to write prose. You're the author of 2 books. I have the latest one, How to Write One Song. I read the whole thing. It's a wonderful read. Why is it important to you to sort of let the general public in on some of your tricks of the trade in writing songs?
Well, I genuinely believe that it's a really good thing for people to do, to spend time with them, with the creative side of their brain, to spend time with themselves in a productive way. Not that they have to produce something of value or anything, just to make something that wasn't there when they woke up. I think that that's a really beautiful thing to participate in, and I think a lot of people deny themselves that, and I'm not sure why. Like, I guess the argument is that not everybody's good at writing songs, or not everyone is good at painting or creating, and I find that strange, because we allow ourselves to do all kinds of things we're not good at. We, you know, play beer league softball, and nobody doesn't want to throw a frisbee because they suck at it. Well, maybe they do, but they at least give it a shot. And I think that creating is sort of the same thing. It's just a healthy activity that I would like to share my belief in it.
Words of wisdom there. Again, that was Jeff Tweedy of Wilco talking with us from his tour bus back in August. Well, legendary football coach, broadcaster, and video game icon John Madden died yesterday at 85. As part of the top CBS broadcast team, Madden called many Bears games during the magical 1985 season. In January 1986, prior to the NFC Championship game here at Soldier Field, Madden joined John Callaway on Chicago Tonight, and our crack tape library team was able to track down this interview. Callaway asked Madden to share his thoughts about the Bears' feisty coach.
John Madden, I want to go back and ask you, and thank you very much for being here, and ask you what you make of this man, Mike Ditka. What's your assessment of him as a coach?
I think Mike Ditka is, I think he's done a better job than anyone else that started the year. I think, you know, they have all these coaches of the year, and they always pick someone who you didn't expect to do as well, and they do well. And my criteria is always everyone starts in the year to win them all, and I think the guy that wins the most and goes to the Super Bowl and wins the Super Bowl ought to be the guy. And I think Mike Ditka's done the best job. What I like about Mike is he's a fiery guy. I mean, I think, you know, you have to have some of that. It's an emotional game, and it's fiery, and you got to get out there and, you know, and roll around and stuff, and Mike's ready to do that, and he's smart enough to give his players a little rope. I don't think you want to get too tight on those guys, and that's a fun thing about the Bears. And I think that you know, he's put them together, and he's got them all on the right track, and he has a good coaching staff and the right players doing the right thing. I think that this is the year of the Bear. I mean, it's just their year. Everything that they're doing, they're going about it the right way.
Talking about going about it the right way, you seem to pack an awful lot of useful information into the analysis that you do, but you seem to be having a lot of fun. Are you having fun with CBS?
Yeah, I have fun. I have fun. I have more fun with football than I do with CBS. I mean, if I had to go at CBS and sit at BlackRock or something, I'd hate the joint. But I like being at the game. I'm seeing the guys run and hit and drop, and, you know, kickers miss the balls. That to me is fun, and being there and watching it on film and practice and talking to players, and I really enjoy that part of it.
Well, now, is it true that you don't fly, and so you don't have time to take a train? Will you be here all week?
Yeah, because I would have. I don't fly, and I take the train. So if I had gone back to California, I would have gotten back to California the day after I'd have to leave to get here. So I would have spent 4 days to get where I already am.
I'm going to get a transcript of that, John, and study it, and then I'll have a follow-up question. What are you going to do in Chicago? Do you need restaurant recommendations or anything, sir?
No, I'm here. I'm down at the Ultimate Sports Bar and Grill.
Yeah, you can just stay there, right?
Yeah, I'm staying here.
That's the late John Madden on Chicago Tonight back in 1986. And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that's our show for this Wednesday night.
And please join us tomorrow night live at 7. More on the impact this latest COVID surge is having in Chicago and across Illinois.
And a win over the Seahawks gave some seasonal cheer. Up next, the Bears face the Giants. We have a preview. And now for all of us here at Chicago Tonight, I'm Paris Schutz.
And I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Clifford Law Offices, a personal injury law firm which is proud to honor founder and senior partner Robert A. Clifford and partner Shannon McNulty for their award for excellence in pro bono and public interest service.